Hey guys, and welcome to today's live stream. We're going to be talking all about that hump on the back of the neck, what it is, what's causing it, and how you can go about reducing the prominence of that so that it puts your neck in a better position and generally it's just fixed a little bit more effectively. Hopefully you're going to find it really helpful. I know this is something that really bothers a lot of patients that we see in the clinic, and we're really going to help you guys understand that. If you're new to the channel, please do consider subscribing. We do these live streams every single weekday. It's your opportunity to listen in on the topic that we're talking about today, obviously being this hump on the back of the neck or other back issues. And also we've got that Q&A at the end of every single live stream as our way of helping you guys. So Lara's the other side of the camera. She can see all of your comments. So if you post those in there, if you've got any questions, and we will get to those in the Q&A section at the end. And with that out of the way, let's get into today's live stream. So this is a topic today, the neck hump. It's something that really bothers particularly a lot of ladies. We see people coming into the clinic and they're digging around the back of their neck. They've got maybe some neck pain that's led them to come in, and it really concerns a lot of people. And we want to talk a little bit about sort of what is causing it, but also give you guys a little bit of reassurance as well that something can be done, but also a bit more understanding about what exactly is going on there, because it'll hopefully for a lot of you put your mind at a little bit of ease. So first and foremost, there's two types when it comes to sort of this prominence on the back. It's around about where your necklace is, and usually maybe you'll be out at an event or something like that. Someone's snapped the photo from the side, your hair's up, or if you haven't got much hair, guy for example, it's not covered anyway, and you see that shot, and all of a sudden it starts to bother you on a mental level. So it's something that can really affect people. And we've got the bone type and we've got the fat type. Now the fat type, the Dowager's hump, that's adipose tissue lay down, and we're not really going to get into that one that much today. We're going to cover more the bone one because there's a lot we can do about it mechanically and help you guys understand it. And the first thing I wanted to point out to you guys is the bone is supposed to be there. It is normal. I want to start this live stream with doing a little active test with you guys so you can actually appreciate that, because if you're there thinking, as so many people do, they injure their neck through maybe repetitive strain, a lot of desk-based work, etc., on the smartphone, like that all day, it puts a lot of stress and strain on the neck, and all of a sudden we have neck pain. Then we go and start digging around this area and realize, oh my gosh, what are all those knobbly bits on the back? What's happening? So first and foremost, I want you to pop your hand on the back of your neck around about where your collar is or where your necklace would hang, and just look up slightly, lift your chin up slightly, and you're going to feel that if we loosely, very gently run our hand along the top of our skin, we're not going to feel too much in the way of bony bits. There might be a little bit down the bottom. Now what I want you to do is look all the way down and run your hand along that same area. You're going to feel that the bones stick out an awful lot more than they did in the first position. And I've got the little man here to demonstrate, obviously this being the front. When his head is in a good posture, we can't really touch this ball bit being his neck. But if he leans forwards loads, we can all of a sudden start pressing on this area and it sticks out a little bit more. And that is what I'm depicting in this image just behind me here. The C7 vertebra is what many of you are feeling. That is what the hump is, so to speak. It's the way in which the skin on the back of our neck hangs over that hump or that enlarged vertebra. It is larger because it's the attachment site for many muscles in that region. Your shoulder girdle muscles, trapezius, etc. Many muscles attaching on there as a strong anchor point. Now, when we're stood with a nice good posture, which is why this guy's got a lovely smiley face, we have the skin, which is denoted by the purple line on the back, which is actually running off the back of his head, hanging down, and then running, and not really sticking out too much. The middle vertebra, of which I've drawn too many zigzags here, but the middle vertebra in the neck don't stick out nearly as much as the anchor point at C7, and arguably maybe C6 is a little bit larger as well. When we stand in this posture here, hence the sad face, you can see, like you felt when you had your hand on the back of your neck, how much this sticks out. And it's not that it sticks out, it's more that we're pulling the skin and the surface tissue over that bony prominence a little bit more, and it's causing it to become more prominent. Now you might ask, well, I'm not looking down at the floor when this sticks out. I was talking to a friend. Why is it sticking out? Why is it bothering me? Well, the reason being, unfortunately, as we've touched on in previous live streams, some people have alignment issues in their neck whereby this is the standing position. So instead of having this nice smooth curve here, the alignment is something like that, and that causes it to stick out a little bit more. We've got a straight neck, maybe it's a military neck, or maybe it is a kyphotic neck, and we see this quite a lot in the clinic anyway, with the younger girls that come in sort of in their 20s and 30s, where they're very slight. They don't really have a history. They say, well, I'm young, I've got these issues in my neck, but they don't have a history of neck pain. It's just maybe a history of a bit of discomfort around the neck, and they come in with these kyphotic neck curves, and it really is a problem. Now, why is it a problem? It's a problem because in this position, if this is the status quo, or this straight neck is the status quo, then we're putting an awful lot more pressure and strain through those discs. And many of you guys that join us on our live streams, when we're talking about back pain, we talk about the reduction in that lordosis, the loss of natural curve in the lower back. And the same thing occurs in the neck, where we have this loss of natural neck curve. It really does affect the mechanics of the neck. So then we get someone who comes in and they say, well, this is the first time I've had neck pain. Why is it so bad? Maybe they've got radiating pain down the arms, etc. And they're in this position to say, oh, it's the lump in the back of my neck. It's the lump in the back of my neck. It's nothing to do with the lump in the back of the neck. That prominence is there. It's natural. It's only when we first injure our neck and start getting all these symptoms, we go digging around there and think, oh my gosh, why is it sticking out? And think about this. When you've injured your neck, generally speaking, you're going to lean forwards like so. People always try and stretch forwards, and that's going to, like we discussed in that very first test, cause the neck bones to stick out more, and you're going to only serve to actually make yourself more concerned that that bone is sticking out more. And this is all too familiar for many of you that watch our live streams, because it's the same things we do in our lower back. We knee hug, we flex, we reduce the curve, and in the neck it causes that C7 vertebra to just stick out or become more prominent. There is nothing wrong with that vertebra. So that I really want to reassure you that fundamentally this bone does stick out a little bit more. And if we lean our neck forwards, as many people do when they have neck issues, it's going to create that or create the appearance that there's some sort of enlargement in that bone, and it's almost never the case that is true, that it's enlarged beyond normal limits. And we do, as many of you know, a lot of imaging work in the clinic as well. So it's just something that's there, that's present, that's a function of the way in which we're holding our body. But what is happening, which is unavoidable and undoubtable, is that in this position we are straining substantially through the discs in our neck. And because we have a greater awareness of what's going on here, it's closer to the face, it's more important that we know what's going on around here compared to the lower back. We feel these things all the more acutely, and therefore returning to a normal position in the neck becomes more difficult when we have these sorts of disc injuries and strains in the neck, which is why we tend to lean forward so much, making the problem worse. It's a very difficult cycle because we are so sensitive to what's happening around here, even more so than lower back pain. So it's something to bear in mind, but we want to have this live stream as useful as possible for you guys. So we're going to talk a little bit about what to do, because you'll go online and you're going to see these exercises that are going to really be bad. And you can see in red just over my shoulder, chin tucks being the main one. And this is where we just pull the chin back like so. This is really, really not a good one to do. What it's going to be doing, especially if you're one of these people that I've discussed where we've got that reduction in neck curve like so, all we're going to do is reorientate a bad curve. It's not going to help us with restoring the natural alignment. It's just going to keep that neck sticking out, and it's not going to help the underlying problem that may be causing your neck pain in the first place. So what should we do? Well, you'll have noticed I've got the band around my shoulders through this live stream. That's a really important one, because we want this band around the middle portion of the neck. And what we're going to do, and you can use a towel for this if you don't have a band, you ideally want a stronger band, but this red one here is easily visible for you guys. We want it in the middle of the neck, and we want to pull forwards and look up gently. And this will be quite uncomfortable to start with, especially if we've got more acute symptoms. And what we're doing here is we're having a pivot point right here in the middle of the neck and allowing that neck to bend backwards over there, rather than just pulling backwards on the head. Because if we just pull backwards on the head, the whole neck's going to move backwards. We're not going to fix certain joints in a better position. So by having the pivot through here in the middle portion of the neck, we support that natural curve. And this is followed up by using that towel exercise through the back of the neck as well. And that towel should be bigger than this, but just roll up a small hand towel, probably the size of a glass like so, something like that, and then we place that in the back of the neck here and lie over that for around about 3 to 5 minutes. That's going to help support your natural neck curve. It's going to be more effective. It's going to move you back towards this sort of position here. And over time, it'll help you just become a bit more aware of how our neck should be standing. Now, if you've got neck pain, those two exercises will really help reduce that. We want to get some ice on there as well, 3 to 5 minutes or so. We want to be avoiding any sort of forward bending exercise, anything that involves chin to your chest, pulling over here or over here. These sorts of exercises are all going to further aggravate the underlying issue that's causing this alignment issue, that's causing perhaps that pain that's in that region as well, because it is all too often that the neck hump is only found when someone actually has pain. They start digging around there, as I mentioned earlier in the live stream. So if you follow that little instruction, the band exercise, maybe 10-15 reps, lie on the towel for 3 to 5 minutes, and then use the ice straight afterwards. Doing that 2 or 3 times a day is going to start to support the neck in its neutral position. And hopefully at the same time, you're going to be a bit more aware of how we're using the smartphones on a daily basis. Being in this sort of position for extended periods, if you can feed those things out, we're going to find that we start to move back towards a better position, the one on this side here, and further away from this position, so everything starts to move back to its natural position. Now, we do work with x-rays in the clinic to get a much better objective handle on exactly where these alignment issues are or aren't, so we can be more specific with the devices that we use to effectively change these things. But for you at home watching this without any images, if you can do those simple stretches, they're really going to help ease the tension in your neck, reduce the alignment stresses, and also help reduce the prominence of this little hump here. So hopefully that's been helpful, and we'll get into some Q&A to help you guys further.
Okay, brilliant. Good morning, everybody. If anyone has any questions, please do pop them in the comment section below. We are here to help. It doesn't have to be hump related. It can be anything like back pain or neck pain related
any
in
questions?
general.
As always.
Just one on the hump on the back of the neck.
Yeah.
When you do become aware of it, it's quite common that you kind of, like you say, go around prodding and massaging it. Is massage going to help you at all?
No. It's a positional thing. It's the bone is sticking out because your head is moving forwards. And also, as I mentioned, the other scenario is where we have a little bit more complex misalignment. And this is sort of commonly in the gymnasts, in the ballet dancers, in the slighter frame people, men and women. They tend to have what's called this military neck, and the military neck means that basically the bones, the spiky bits on these bones are just closer to the surface of the skin. They stick out more because of the position that they're put in, like this example here. And massaging and moving and poking and prodding and acupuncture and all these other things, whatever you want to do, mechanical rubbing the area, from a symptom point of view, it's not going to do anything to the underlying alignment. We have to actually get in there and mechanically move those joints and hold them in the position. And obviously this is what we do in the clinic with regards to the remodeling work, where we use devices that are a little bit more robust, a little bit more targeted, but they will change the shape and the alignment of the neck. Therefore, moving those vertebrae back towards their normal position and back away from the surface of the skin so they stick out less. But that does take a bit of time.
Yeah, and with the exercises, how many sort of sets, reps with the neck exercises would you recommend doing on a daily basis? How long, how many weeks should people be doing this for in order to correct this hump?
Well, I'd probably be doing it as an ongoing practice for an extended period of time, a good couple of months, really. It's not something that I'd stop. You're not going to see results, well, you might see some results because of greater postural awareness. So if we're slouching less and our head's back over, things are going to stick out less anyway. So you will see some maybe immediate changes, but then it's going to be a little bit limited in terms of the progress. Might go up quite a lot in terms of improvement or lack of hump, and then it'll kind of stagnate a little while. And that's where the alignment changes are going to need to take place. So just by being more aware about it over the course of maybe even a week, you might notice some observable differences, but then it will stagnate. So I would be doing the 15 reps or so of just the extension. We're not trying to pull our neck in half. Please, you're not trying to saw it in half with the band. It's a gentle articulation exercise using the strongest band you've got. So there's only a little bit of give in it because we don't want it to give completely, otherwise it's not going to actually serve the purpose. But a little bit of give, or a towel, as I mentioned earlier, doing about 15 reps of that. Lie on the rolled up towel for around about 3 to 5 minutes. And then if we've got that neck pain there, then we can use a bit of ice. But make sure we get off slowly. And there's actually a video on the YouTube channel of exactly how to do the towel and the extension exercise. So just have a little search on there, or we can maybe put a link into the description to those 2 exercises, so you guys know how to do them safely. It's very important that when you do that towel exercise, you get off the towel correctly. If you twist your neck, then you're going to hurt yourself. So please don't do that.
Okay.
That's quite important.
You mentioned the texting on the phone, looking down.
Yep.
Other activities like reading gonna serve to just make this worse? How should you know?
Yeah, at the end of the day, if we're doing these things, we need to hold it up at eye height. The important thing to note, and sometimes people go a little bit too far they go from being very, very bad on the one hand to very, very over the top on the other. The main reason that these alignment changes come about is repetitive strain over an extended period of time. And we know that when we're in the clinic, if we get people doing the right things, using it's a little orthotic for the neck, and the reason I'm looking up there is because it is up there, just on top of the shelf there. But when we use these things in the neck with patients, doing them at home, in a 3 to 4 month period, you can make a 25% change in the alignment of your neck. So it does change. Mm-hmm. But it changes when we've got consecutive days of sustained stretch on those ligaments for 20 minutes. So if you're there reading a book for 3 to 5 minutes, it's not actually going to be doing anything negative to change the alignment. But if you're repeatedly every single day sitting there for 2 or 3 hours or half an hour, still in that position engrossed, we're going to have a bit of trouble. And we're actually seeing this in the clinic a lot more with younger children. Parents, just giving them the iPad, go and use this, and that maybe has happened a little bit more so over the last few months with kids at home with parents, that don't have enough time to work and help the kids as well. They're like this. And if you've ever watched a young child using an iPad, they are engrossed. They will not move. They will be so fixated on what's going on inside that little screen. They will not move. And that, I do think, is having an impact. The same way we're seeing people in their 20s and 30s having substantially worse alignment. They don't have the degeneration yet. They have substantially worse alignment compared to maybe their parents and grandparents, who maybe have a little bit more in the way of degeneration at such a young age because of the way we've grown up around technology and using these sorts of devices. And I can only think of the kids that now are growing up with iPads from the age of 2 or 3. As we're going through our early years, those toddler years, pre-10, and then our teenage years, we are developing these natural curves, and they are essential. We've touched on in previous live streams about the posture and the importance of the alignment in the neck, reductions in neck curve affecting the tension through the spinal cord and other issues. It's really important that we develop these things correctly. So if you're sitting in a bad posture for 3 to 5 minutes, it's not a problem. But when we're doing it repetitively for hours on end, day in, day out, we are going to have an impact.
Okay, awesome. Just some questions coming through. Dave on YouTube has asked, I've been working hard to improve my lower back pain, which includes sitting on a stretch ball at my desk, which has also helped, although it has resulted in neck pain, as you describe. Any advice?
I think the main thing at that stage, if you're using the ball for the lower back, I don't think that's necessarily going to be doing too much trouble to the neck per se. But it might be the fact that you're now comfortable, or a little bit more comfortable, able to sit for longer, and therefore we are sitting for longer and not taking those breaks. So we're in front of the computer like so for extended periods because our back's been kind of dealt with now and we're not moving as much. So the biggest advice would be take some breaks. Try this little exercise, even just using the band while you're in the office and actually, or working from home. And actually doing that exercise around the neck and just doing a couple of these just nice and gently. I've doubled this up to make it a little bit stronger now. But just doing a couple of those, and then you can even do a nice little stretch where we actually come back and then go over the one side slowly and over the other side slowly, just to stretch some of these muscles that are going to be tightening up. Even just doing that for a couple of times through the day to intersperse a bit of focused work on the computer can really help reduce the likelihood of that neck pain, because sometimes, and I know there's a few guys in the Back in Shape that have neck issues with lower back issues. It can make some of the opposing end of your spine, the rehab, a little bit difficult. So try that little one using a little bit of ice as well. And if you've got phone calls or anything like that to do, get up out of the chair, move around. It'll be great for your back and it'll also be great for your neck as well.
Also, just maybe check the ergonomics of your station. Yeah. So if your screen if you're having to look down at your screen, just prop your computer up, or if you're working on a laptop, there are these laptop trays that you can buy that just sit your laptop really nice and high.
The only problem with those trays is that the keyboard goes up as well, so then we're up like that the whole time, and that can affect the neck as well. That is the one
Yeah.
issue with
So
them.
maybe try to rest your elbows on the table if you
Yeah.
can while you're kind of looking
So
at.
it's worth bearing that in mind, but hopefully that helps. That exercise will really just disrupt the tension that's likely going through the neck in a sustained manner. It disrupts that sustained tension and therefore allows a little bit of relief to set in.
Okay, cool. Hope that helps you, Dave. Just moving over to Facebook. Sally says, when being more posture aware and doing the towel exercise, how long does it take to make positive changes?
Well, like I said earlier, with the towel exercise, when you're doing it, you're going to kind of immediately notice a bit of a difference over the course of a couple of days, because you're going to hopefully be more aware of how we're using our posture, of what that alignment feels like when we're essentially straight while we're led on the floor with the towel supporting us. So we'll have a greater awareness of what good posture is, and hopefully be stooping and slouching a little bit less on a daily basis. But if we're talking about an objective change in the neck from an X-ray imaging point of view, then using the spinal orthotics is something that really needs to be done. But I would continue to do it for an extended period of time and really just take progression photos. You can do the towel exercise for longer, but I'm a bit reluctant to recommend that to people, because in terms of when we talk about changing the alignment, we want to support better alignment. But if we start saying, okay, do this to change your alignment in a more objective manner from an X-ray point of view, we don't 100% know where certain people are from an objective point of view with an X-ray measuring that curve, and therefore we don't know how far we want to go. But generally, if we're doing these sorts of exercises for 20 minutes a day, you'll get around about a 25% change in alignment, increase in curve over a 3 to 4 month period. So use that as a measure. But if you're doing it for 5 minutes, it shouldn't change too much.
Okay, awesome. Dave just got back to us on YouTube. He said, great, thanks. I tend to slump forwards on my ball and get a pinching style sensation on the back of my neck. Thanks for the advice.
Yeah, that's as we're going forwards like that. And it's just that tilting back. So we're going to be having some hyperextension through the upper part of the neck, which is going to close in on those little facets, potentially pinch the nerve a little bit, or just irritate the facet joint, because they're kind of hitting into one another in that extreme position, especially for extended periods. So get that head back upright, use a towel, open out your posture, and if you're doing any of the back and shape exercises, those middle back exercises to strengthen up that upper back, is going to really help to keep you with good posture, so that you're supporting the rib cage and the head over the top.
Yeah, he just said exactly. If this is something that he's just noticed now, like a new aggravation in that lower back, is it better that he does something sooner rather than later?
Yeah, fix it sooner rather. It's always easier to fix a minor problem than it is to fix a crisis, because when you've got a crisis, we have to then deal with the symptoms, and the symptoms often stop us doing the things we need to do. Many of you guys watching this, for example, with the towel, will know that when you started the towel the first time, it's actually quite difficult, because there's so much inflammation in that back that it gives us, when we close the holes in that lumbar spine back to normal from enlarged, that can give a little bit of discomfort and therefore make us confused and say, well, this is uncomfortable. Is it good? Is it bad? I don't know. And then we go into recoil mode and don't do anything. So it's always better when we have minimal symptoms to address some of these underlying issues. We can be so much more productive. We can, for example, with the back in shape stuff, we can get straight through phase 2 very quickly and into phase 3 much faster if we don't have the inhibition of a more aggravated pain.
Okay, awesome. So for Dave, definitely the towel in the lower neck.
Yep.
Exercises and icing as well.
Yeah.
Okay, brilliant. I'm just gonna move back to Facebook. I've got a question here from Saleh. He said, can you do the exercises even if you don't have a neck problem? Does it help to prevent?
Definitely. So you remember what I mentioned earlier about the kids using the iPhones and the tablets, etc. Just doing something to open out your posture is good. We don't, for example, with our windows, we don't wait until they're completely opaque before we start cleaning them. We do a little bit of cleaning, etc. along the way. We don't need to wait for the catastrophe. Doing these little things is a nice sort of meditation, relaxation exercise. If you get in the house and, from a day out or whatever it may be, maybe you've been in the garden or out meeting friends or come back in and you want to just sit down and relax for a few moments, why not just jump on the towel? We had one of the guys in the Back in Shape group this weekend, I think it was, ask about doing the neck and the lower back towel simultaneously. We don't necessarily recommend this when you're first starting, because the technique needs to be correct and the placement, you need to be comfortable with that. But once you are comfortable, jumping on both towels for the neck and the lower back puts our spine in a lovely position. We've got the neck curve supported, the thoracic kyphosis is there, and then we've got the lower back supported. And we can just lie there for 3 to 5 minutes, relax, unwind. Maybe you do a bit of meditation, pop yourself off and crack on. it's better than just sitting in the chair, and it's generally rather comfortable for a lot of people at that stage, especially if they don't have symptoms. So just having a moment to set your body in a nice position is always a good thing, and it's something that I do after going to the gym and that sort of stuff. It really, really helps.
Okay, brilliant. Fiona said, morning, the more of these videos I watch, the more I want to throw my phone and iPad away.
Yeah, I mean, you have to bear in mind, it is a toss-up. You know, these things have numerous ways in which they improve our quality of life in ways that are immeasurable. We never would have thought, especially with what's happened the last couple of months. Imagine that happening, 20, 30 years ago, where we didn't have phones and FaceTime. That would have been, orders of magnitude worse in terms of isolation. So these things do massively improve our quality of life. They improve our our ability to access information, education, etc. And a lot of you guys wouldn't be watching this if you didn't have one of these phones. So bear that in mind. But it's just understanding that with a new thing or with a device, there are good things and there are bad things, and there are challenges and benefits. The same way you wouldn't say, well, I'm not going to use the car because it involves me sitting for 1 hour a day. The car allows you to get from A to B. So we just have to understand that there are issues involved with using these things and that they are great, but if we can use them a bit more responsibly and be aware of how we're using them, that's going to make a big difference.
Okay, awesome.
Little
Brilliant.
lecture there. Sorry guys.
I think that is everything for today. Some fantastic questions, so thank you everybody.
Yeah, thanks for those questions, guys. Hopefully it was helpful. I know it's a little bit a different one. We're coming up to the top part of the spine instead of the bottom, but a lot of the fundamental truths, because we're dealing with lordosis in both areas, these fundamental truths are so relevant, and hopefully this little test that we did at the start has just reassured you. If you're a little bit concerned about the neck, I know some people do get themselves awfully worked up about it, thinking that there's something fundamentally abnormal there. They really do get worked up, and hopefully that's just shown you that actually maybe it's not as abnormal as you were concerned about, giving you a little bit of reassurance and some helpful exercises that you can do to fix this. If you are new to the channel again and you've watched us this far, please do consider subscribing. If you know someone else that has a little bit of trouble with their neck, then please do consider sharing this with them. Maybe they'll get a little bit of that reassurance that they need. So thanks so much for joining us today, guys. We will see you tomorrow from the clinic, I believe, with another live stream. We've got some really interesting bits and pieces coming over the next few weeks. So thanks for joining us, and we will see you tomorrow with another live stream. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune into some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.